Welcome to Voices in Health and Wellness. This is the podcast where we dive deep into conversations with the thinkers, practitioners, and trailblazers who are redefining what care looks like today. I'm your host, Dr. Andrew Greenland, and today I'm genuinely excited for today's guest, with Dr. Jeff Gross, MD. Jeff is a board-certified neurologist and regenerative medicine specialist, but he's also a visionary at the intersection of science, performance, and patient transformation. He's the founder of Recelebrate, a company that helps people literally put their own stem cells to work to rejuvenate from the inside out. And what makes Jeff's work so relevant for this podcast and for all of you listening is the deep commitment to root cause medicine. Whether it's stem cells, peptides, or neurorehabilitation, Jeff's focus is always on resolving cellular dysfunction and helping patients thrive. So with that, Jeff, I'd like to welcome you to the show and thank you so much for joining me.
It's my pleasure to be here. Thank you so much.
Perhaps we could start just from the top. Could you share a little bit about your background and what led you into this space of regenerative and precision medicine?
Well, my patients get the credit for nudging me into sort of this more logical, precise, cell root cause thinking. But I'm a practicing neurological surgeon with a fellowship in spine surgery. So the vast majority of my career was dealing with people who had neck and back trouble, disc problems, pinched nerves, all kinds of things requiring a host of treatments from physiotherapy all the way up through surgery, making surgery the last option, of course. But there's a large gap in that treatment menu. And that gap is, there's therapy, there are medications, there might be some pain management injections, and then there's surgery. And so many clinicians just, when they're out of things to do after the injections, they jump to the surgery because there's nothing else in there to try. Well, that was frustrating for my patients and for me for many years. And I felt stuck in a career that was not offering anything relatively new. Yes, there's a new implant or surgical approach, but it's the same old thing. So my patient said, "Hey, doc, how about this or that or stem cells?" And luckily I have, baccalaureate background in molecular cell biology. So I said, I miss those topics. And one year, instead of going to the spine surgery conference, I went to a stem cell conference. And it's about 7-8 years ago. I just dug my heels in and said, wow, a lot has happened since I had my medical training in the biological fields, and the clinical applications have been tried and tested, but not here in the States, mostly in Europe and in Asia. And in the States, we're sort of held back by influences by the pharmacy companies and other companies that make surgical hardware. So I said, this is ridiculous. We need to protect our patients and offer them everything that's potentially helpful. So I dug in and started offering for my spine patients things in the stem cell realm. And I'll say that broadly because there's so many things, but that has opened up my practice to longevity and treating other parts of the body and general wellness through self-regeneration. And now it's all I do.
Amazing. And I totally resonate with your philosophy because in conventional medicine, of which I practice as well, we really only have two things in our toolbox day to day: drugs and surgery. So I'm delighted to have this conversation to explore what else is available and hear a lot about sort of stem cells and some of the other therapies you've talked about. So I guess this was your inspiration to launch Recelebrate as a business company clinic. Is that right?
Right. Yeah. And we wanted to have the name match the philosophy to celebrate the renewal of our own cells, which we can do naturally. And we have done for, millions of years or beyond. And now we're tapping back into that with a renewed enthusiasm and knowledge.
So what does your clinical and business work look like day to day at the moment? Because obviously you've got fingers in various pies. There's obviously the development work, there's the clinical work. How does it all pan out for you at the moment?
Well, as a top level proviso, I'm trained as a neurological surgeon and we're crazy workaholics to begin with. So I do a lot of things, but my professional day is still seeing patients 5 days a week. We try to make ourselves available, and we love offering things to people that they can't find in the traditional, mindset typically. So I see patients in the clinic. I do televideo appointments, and we have a filled calendar. Usually 1 day a week is set aside, at least maybe half a day to a full day of doing injection procedures. I do a lot of joints and spine regenerative injections, and we do that at a local injection facility, sterile conditions, what have you. And then I change hats, and as the mediocre businessman that I might be, we have a nutraceutical line based on regenerative medicine. It's a plant-derived exosomes, and we've got some other things we're working on in that space so that we can expand the offerings to many more people who may not need a knee injection or a spine injection or an IV to stimulate their stem cell and regenerative activities, but might want to do something preventative or support longevity.
Amazing. I mean, you have a very fun-packed schedule, but I mean, with all of that, how do you find time to innovate? Because you are a great innovator. So where's the time for the innovation?
The innovation happens sitting in front of each patient. You learn something new, you try a new approach, and every patient is a learning experience, both for the patient and for myself. And we collect enough of those observations, and as a clinician, you don't stop learning once you go into practice, right? You continue to gain and refine your tools, and you think of new things. Well, why don't we try it this way? And that's where that comes from. I don't think I sit at home and think, oh, I have an idea. I think it comes right in the clinic.
Amazing. And what major shifts are you seeing in regenerative care right now, whether it's clinical, technological, regulatory, or all of the above?
Well, I see that we're going into a more precise area. So, we're not talking as much science here, but when you look at stem cells and the signaling that is given off by stem cells, which are called, the secretome, what's secreted by stem cells. We have these growth factors, we have these small vesicles we call exosomes. We're now looking at more precise exosomes that are for muscle mass, exosomes that are for bone development, exosomes, secretome that might be for improving the pancreas health, maybe in the diabetes population. So I think that this in 2026, we're going to see a lot of this more specific precision medicine in the regenerative space, and not just the generic shotgun blast of stem cells, which are helpful, but boy, if we can improve that help, we're just moving the needle forward to help people get the type of results that they desire and we want them to have with less invasion.
Brilliant. What's the current patient awareness of therapies like these? Do they come well informed, or you have this massive repertoire of tools in your box that you can offer people who are uninformed? What's the kind of situation?
I think there's a spectrum, but let's focus on the two poles of the spectrum. We have an audience that already has an appetite for what we do. They've researched stem cells or regenerative medicine. They have shopped it. They come prepared, saying, I'm seeking this. And, those patients are great because we're all ready to offer them potentially something if they're a candidate. Then we have the other side of things. People see me maybe for a back pain, a spine condition. And, when I lay out the options from injections to surgery to regenerative approaches, sometimes they're quizzical and they're misinformed. They think it's illegal to, have stem cell type of treatments here in the US and in other places. And we have to explain that it's the marketing claims that we have to be compliant with, and that we always want to use high quality donated sources that are tested, screened, and accredited, things like that. So when we source stem cells or secretome or exosomes or amniotic products, we want those from a non-COVID vaccinated mother who's been screened and healthy, and the tissues have been tested in quarantine. They have no endotoxin or difficult to define hidden occult infections or any problems. We want the best sources. And these are regenerative biologics that I use on myself and my family as well. So I wouldn't offer something less to any patient. We want them to have the best results because that is our best way of showing results.
Thank you. I think you just briefly touched on the regulation around advertising claims. So what is the kind of regulatory environment looking like globally for things like stem cells? You've probably got a better idea about the US, but do you have any sense of how it kind of pans out globally?
Well, there are a lot of clinics next door to the US in Mexico and in Central America. And there are patients that still think one has to leave the country, the US, to go to these clinics to have some type of regenerative treatment. That's not the case. However, those regenerative clinics can make claims. They can make what are called cure and treatment claims for a disease or condition. Here in the US, those marketing claims have not been approved, so we can't make those. We can show medical evidence. I can give published medical journal articles. I can show before and afters of anecdotal patient care, but I cannot make any claims, and we do seek that compliance to maintain it all the time. I really can't speak too much to other locations, except that many places in Europe are way ahead of the US, and they have, some of the research we base our actions on have 15-year follow-up studies published in Europe. Asia is also very cutting edge. China is typically the first to try something, and there are a lot of publications out of China, Korea, and Japan as well.
Thank you. Do you think mainstream healthcare is equipped to integrate this style of medicine or cellular medicine at scale?
Not yet, and I don't think they have an appetite for it yet because it doesn't fit the financial model, and the financial model is the tail that wags the dog. Unfortunately, they are deeply rooted in undue influences from the large pharmaceutical companies and other health insurers, at least here in the US. And that payer system dictates medical care at the corporate level and cloaks it under some type of statute. But make no mistake, it is the corporate practice of medicine. And it is rationing by hassle every day. And we have patients complain. And I say, don't complain to us. You're the one that bought that insurance plan, or that's the government plan that you voted for. So it's out there. So I don't think that organized medicine is equipped for this. They're not training this in the medical schools. And we make ourselves available. I'd be happy to lecture at medical schools on regenerative medicine and how it stimulate these young minds going into medicine.
So it ain't happening anytime soon. But I mean, is there a financial saving overall for somebody with a particular condition if we think about using this treatment versus, more invasive surgery as an example? Or is this really going to just not really advance beyond a private setting?
No, I think there is a cost savings. We've seen that in the US. The lowest form, and I don't mean in a bad way, but the entry-level form of regenerative medicine is called platelet-rich plasma, or PRP, which is taken from your own blood. And that is also not yet approved for marketing claims. But some of the health insurers, the private health insurers, have started to pay for that because the accountants have figured out it's cheaper than a joint surgery or repeat cortisone injections. So I think that as the more detailed financial analyses come to play, that there will be a move towards looking at the long-term economic benefits of a regenerative procedure over, let's say, a surgical joint replacement.
Thank you. Where do you think the biggest misconceptions still lie in your field, whether that's from patients or fellow clinicians?
Well, I think patients are more open-minded and are looking for a less invasive option. But I have to sink my teeth into the question about clinicians because, we're trained, through our schooling and our here in the U.S. residencies, or I think your registrars over across the pond and things like that. And that training usually comes from professors who are 2 or 3 decades older. And the forward movement scientifically in advancing clinical medicine is very slow because there's this apprenticeship generational slowness of moving forward. It's so hard to get the professors who are older to adopt these new ways, or at least take a fair look at them. And sometimes the science isn't funded because it would work against those providing the funding. Government, big pharmaceutical companies, things like this. So I think that medical training is stuck in the old ways because of that. And I see that in my own field as a neurosurgeon, spine surgeon. For 30 years, I've been going to spine surgery conferences, and they literally present the same material decade after decade. Yeah, there's a new widget. There's a new, this incision's a little smaller, or maybe it's robotically guided or something, but it's the same thing that we're doing. And nothing's changing. And that gets old. And I saw no innovation. So to the clinicians out there who are not telling their patients that there are other options, they are doing them a disservice, and they are actually violating the doctrine of informed consent, because informed consent must have all options listed on the table.
Got it. So We Celebrate is a business as well as a clinic. And what's working for you particularly well right now, either clinically or operationally?
Our low-hanging fruit is the joints and spine injections, inflammatory joint degeneration, wear and tear, osteoarthritis, and these are all in the same spectrum of joint pain. And a life of accumulated cellular inflammation typically has a patient that suffers some joint pain. Joint pain is an early clinical indicator of inflamed cells or accumulation of some bad lifestyle habits, So we see some of the best results from addressing joint problems. And we do the whole spectrum. It's not just come in and get an injection. We want to talk lifestyle, epigenetics, sleep, exercise, nutrition, supplements, avoidance of certain behaviors, smoking, too much alcohol, things like that. We want to cover everything because people will have a better outcome if we set the foundation before we jump into regenerative medicine or peptides or senolytics or things like that. So that's our probably one of our most rewarding things we do. Mythology.
And on the other end of the spectrum, what's sort of more frustrating, or where do you kind of hit bottlenecks or find challenges in your work?
The mythology surrounding regenerative medicine that's perpetuated by traditional medicine, clinicians who aren't open-minded. It has to do with, I thought that wasn't legal, to, I thought it's cost prohibitive, and it really isn't, all the way through, I thought you get these from aborted babies, which of course we do not. Things like that. We have to overcome that mythology. So being on a show like yours, it gives an opportunity for us to share the truth and let people know there are better natural options, because our body knows how to heal best. Sometimes we just need to remind it.
So it's really an education piece, really, from what you're saying.
Yes.
Amazing. And in terms of running the clinic and tracking outcomes, what do you sort of most focus on measuring? What are your kind of key metrics or things that you're perhaps really trying to improve on at the moment?
So on the joint side of things, cartilage regeneration, we look at, number one, clinical improvement, and that is by symptom, how do you feel, and function, what can you do, and MRIs in those that are interested. So we target off of MRIs to begin with, and a year later, if someone is so inclined, because you don't have to have an MRI if you feel great, but if they're interested, we can do an MRI, and we do have before and after MRIs where we have actually shown cartilage regeneration.
In terms of you do a lot of things. You're obviously clinical, you have a business to run, you're seeing patients, procedures. What's your biggest time drain? The thing that you takes you away from the things that you actually like doing in doing this kind of clinic operation?
It's the administration, right? All the licensure and paperwork and renew this and the red tape, we call it. So that stuff really drags on me. I have help. I have good help with that, but still it has to come across my desk. So that's probably the biggest waste of time, but it has to be done.
Yeah, absolutely. And similarly, if you had a bit of a hypothetical situation, if you had a tenfold increase in patients that are interested in your services next week, what would happen? I mean, would anything break, or would you have a sort of system or capacity to mop up the extra work?
The obstacle for me would be spending time with those new patients. The procedures are brief. That isn't an issue. I could do 10 times more procedures in a week. It would be being able to get all those patients in as consultations and ordering the testing and the labs and the follow-up. So I might have to hire a young clinician who's open-minded to work with me so we can grow together.
And what's on the cards for the next 6 to 12 months or so, whether that be as a clinician or a founder or as both?
Well, we're opening our own state-of-the-art injection facility, and it has a 3-dimensional low-field CT scan. We'll be doing our procedures in even a more precise way with the highest available technology in our own facility. That'll make things just incredible. It won't save any time, but it will allow us to practice at the absolute highest level that even many hospitals don't have. Second, we are working to expand our line of biologic nutraceuticals. We have one product, plant-derived exosomes from curated Italian organic fruits, known to support the phytonutrient delivery to our cells in the Italian Mediterranean blue zone to support longevity. The preclinical studies are showing improvement in anti-aging genes, particularly SIRT2 and reduction in reactive oxygen species, meaning less cellular stress, less cellular inflammation, all markers of longevity. So we seek to add some additional products down the line here that are exosome-based. Exosome, of course, being a vesicle from a cell. So we use a lot of stem cell-derived exosomes, but this is a plant-derived exosome nutraceutical. So it's somewhat laborious and expensive to derive these from plants, but we do now have the lab techniques to do it.
Sounds really exciting. Is there anything else that you're particularly excited about coming online, or things that you may have seen in the research and you're sort of itching to get your hands on as bringing in as a therapy that you can help patients with? Great question.
We just sourced some natural killer cell exosomes that we use as an adjunct for cancer care to support, the immune clearance of cancer cells. We are sourcing MUSE cells being a very small percentage of stem cells, which are even more robustly powerful in their abilities to regenerate. We're looking at other tissue-specific exosomes, as I sort of alluded to earlier, that I think is going to become robust. And we're going to have neural stem cell-derived exosomes. We already have sourced some skin stem cell exosomes we're going to be using to assist with hair regeneration in a more robust way than we can with regular stem cell exosomes.
Well, the future sounds really, really exciting. Are there any medical conditions, chronic medical conditions that you think at the moment don't really get a very good deal? And is there anything on the cards that you think may help them going forward?
Yes. So we like to use the regenerative biologics to help people with autoimmune issues. Autoimmune being a revved up immune system, an overactive immune system against the body. And the regenerative biologics are incredible at reducing inflammation. So we can help sort of reset the immune system, reduce inflammation, reduce flare-ups, and even suppress patients who have these issues. And we can do that without pharmaceuticals, without these immune suppressants, which do have a downside.
I was actually going to ask you about downsides. So all this treatment sounds fantastic, and the potential for healing and regeneration sounds amazing. Just speaks a little bit to the downside, so people are get a kind of a 360 kind of view on all of this.
Fair enough. There is a theoretical risk of rejection with cells, because cells are foreign. However, stem cells are immunoprivileged. They modulate the immune system, and typically we don't see any type of reaction beyond maybe a 24-hour low-grade fever. Nothing like a blood transfusion reaction, which you do have to cross-match. You do not have to cross-match stem cells. Exosomes are even less stimulatory. So we have never seen any meaningful rejection or reaction to exosomes. So we like that. Exosomes have fewer markers on the surface, and they're not identified as foreign to the body. They are bioidentical to what your own body would produce. And we know this to be true because if you look at pregnant women tend to have beautiful skin and growing hair. They're glowing and they're healthy. And of course, there's a survival advantage because they're about to extend the species, and they should have that. But it's because they're getting a daily dose of stem cell derived exosomes that are small enough to cross the placenta into their own body. And that's why they're getting those benefits. They are not getting stem cells crossing the placenta. The cells are too large. And if they were getting stem cells crossing the placenta, they would have to deal with, a large amount of cells being 50% foreign to their body. So not that I'm worried about a rejection there, but there are cases where, there is a, mother rejecting the fetus situation. And I wonder if that has something to do with, some type of difficulty in the placental barriers holding tight. So we know that the exosomes are less immunogenic.
Thank you for clarifying. So if you had a magic wand and you could fix one thing in your business or the wider speciality or field that you're in, what would that be? We've already taken away the paperwork and the admin. Is there anything else you would like to be able to fix with a magic wand?
We'd love to make this widely available to all people, which means we need to spread the word and educate people accurately as to what is out there, what is available to them legally, compliantly, and that would be getting the word out better. So here we are in your podcast, which is the tip of the spear in free speech. We are held back. We cannot advertise on Facebook and Google and large social platforms where people go to, entertain themselves and sometimes educate themselves. So I would love to wave that wand and really open up free speech on all platforms, not just on your show.
Well, anything we can do to spread the word through this, and obviously we'll get the word out and hopefully get as many eyes and ears on this conversation as possible.
Thank you.
If you could rebuild Celebrate from scratch tomorrow, would you do anything differently?
Oh, I'd probably do a lot differently. We've spent money on certain things we've done, whether they're brochures or websites that I would have done very differently, maybe save some money over here. What events we've attended to promote what we do, where I give lectures, I would have probably gone some different directions. But this, you can't learn if you don't make these mistakes. So, and not that they're mistakes, but we probably have higher yield in expanding our reach, and we're learning how to do that. We're getting better at it, hopefully every month.
Brilliant. Hindsight is a wonderful thing, but
right?
Sometimes one just has to learn organically to kind of get these lessons. Is there anything about your current model you'd love to evolve, but probably just haven't had the time or the resources to explore yet? And you've obviously been a great innovator and you've got lots of things on the cards, but is there anything left untapped at the moment?
Well, administratively, we're implementing a new, electronic system to automate things, but I don't want to depersonalize it. So I'm very careful. I still want to have face-to-face time with all my patients and have them have a smooth experience without feeling like a number, because all too often patients in the more institutional systems are just a number. And on the clinical side, we're going to streamline all our procedures. People fly in for these procedures from all over. I'm here based in Las Vegas, Nevada, which luckily is a reasonable destination for people that can come into town, enjoy a nice show, have a good dinner, maybe, throw some dice around if they enjoy that, and then have a procedure before they go home. So we're trying to make that a smooth experience. With our new injection center, we'll be doing that.
Amazing. With that, Jeff, I'd like to thank you so much for your time on the podcast today. It's been such a rich conversation, really interesting to hear your insights. Hopefully you've been able to educate our audience about the value of regenerative therapies and stem cell therapies. So thank you very much. Really appreciate it.
Thank you.